My name is Floyd Willis. I'm a primary care physician. I have been on staff as a staff consultant at the Mayo Clinic in Florida for the last 27 years.
Well, I met Dr. Willis in 1992. He started here at Mayo at the beginning of 1992, and I started in September of 1992. And we just hit it off immediately, but then who wouldn't just hit it off with Dr. Willis? He's such a kind, wonderful man.
Over 26 years ago, I was his pastor, and he was the main assistant in helping me to go on my first retreat, silent retreat. He just became an outstanding counselor. He didn't know it, but he really was.
I would often see Dr. Willis at lunchtime when most of us were either catching up on our notes and he was still seeing patients. And I often saw that they were members of his community or his church, and he was making sure that they had access to him. It didn't matter if it was lunch or it didn't matter if it was 5 o'clock. He was still there for his patients.
He practices excellence in health and will bring that out of you, at least help you mentally to deal with your physical condition, because he always sees to it that you get attention and specificities. So he's a man who is for the wholeness of people.
I always really admired him because he had such a view not only of what we were doing here in our department, but also a view of the community and his friends and patients and the people that he knew from work or church or his children's friends. They were so important to him too, and I could always see him taking his love and his care for his patients here at Mayo beyond his day job and into everything that he did in the community.
I grew up in a very small town where I was interested in the sciences from a young age. What propelled that forward was an interesting experience that my father had, who was a funeral director. There were some funeral directors who were paid to act as emergency medical technicians as well. Unfortunately, the African American funeral directors were not given these sums of money from the hospital. They were not certified, and they had never been told that they needed to be certified. My father challenged this policy, and they suggested that his group, his friends, would not be able to pass this test. He took that as a challenge, and each night he was studying for the emergency medical technician test. He would ask me at age 11 or 12 to recite these questions and tell him whether or not he had gotten the correct answer. And I did so. Long story short, he passed the test, and the county had to reverse their policy of excluding African Americans. So he said, this is good, you'll be able to do this when you are a funeral director. But I got very interested in the EKGs and the blood pressures and the other things that he was studying, and I was not at all interested in mortuary sciences. I said, I really feel like I want to go into medicine. And although my father was a little disappointed, he understood, and that really was the origin of it. Access to health care, or lack of access to health care for some groups, was something that I really was exposed to, of course, growing up, but formally in some of the classes that I took when I was in undergraduate school, and absolutely when I was a student at Morehouse School of Medicine. I carried it with me to residency training, and I carry it with me to this day. It's very difficult for me to go through a day without thinking one way or the other what a great negative impact the gap in healthcare has on this country. I have been very fortunate throughout my career to not only take care of patients, but to have the opportunity to be involved in education, some research and training at Mayo Clinic, where I not only get to work in these areas and try to improve it in some small measure, but also to teach students the importance of it.
He has that gift. He's a person who loves people. I think any person who is a people's person, somewhere along the way they become a hero.